Welcome one and all. Myself Dr. Tarun Prashant. Today's class is going to be on special tests for knee joint examination. Why do you need this class is in order to know the complexity of the knee joint. The reason why a patient comes with a pain in the knee joint can be assessed at multiple levels based on the age of the patient. But when it comes to an athlete or a patient who is at his physical prime with a knee joint issue, it should always be looked by intricate details. So in order to know the intricate details, the first thing that you know is how the knee joint is intricately positioned or poised. Here there are two pictorial representations of the complexity of a knee joint. You can see that as of now, this is a joint that you're looking with the knees flexed from the anterior view, and the second image being the posterior view of the knee joint. In both these, in the first picture, all the muscles around have been removed. You can see that the patella is not present, and this comes to only within a joint where you can see the articular surface of the tibia, which is larger and flatter on the lateral side and more oblong on the medial side, with something called as the trochlear notch on top. So this trochlear notch is the place where your patella is going to be seated with more amount of coverage on the lateral facet of the patella. So the three main structures that are present within the knee joint, which give the main restraints for the stability of the knee joint, being you doing squats, you jumping, you doing multiple activities from football to all the sporting activity, is by these three things. The two outer structures on the medial and lateral side, which are your collaterals, and your two inner taut structures arising from the tibia from the anterior, which is your ACL, and from the posterior part of tibia attaching on the medial side of the femoral intercondylar notch, which is your PCL. And you can see two proper shock absorbers at the middle, which is the meniscus, which is your lateral meniscus and your larger medial meniscus. And you can see that both these meniscus have attachments in between, which are called as transverse ligaments of the knee. You also can see from the back where you can see the posterior meniscofemoral ligament, which is starting from the lateral aspect and running in the intercondylar notch. A better structure of the collaterals can be seen on the posterior aspect by the wide base of attachment of your medial collateral and the fibular collateral ligament attaching on your head of the fibula. The other things that you can see are for the posterior condyles and the adductor tubercle, which almost always is the reference point for where your femoral head lies. So these ligaments and the meniscus along play a vital role in giving the stability for the knee joint. How does it give or provide stability? It provides stability in totally three planes. The three planes, the first being the coronal plane, wherein the patient having either be it a valgus force or be it a varus force. So exerting the patient to both of these in the coronal plane is going to put your collateral ligaments at stress. Whereas in the sagittal view, the cruciates come into action in preventing the translation of your The cruciates being attached in this manner prevent for translation of the tibia in the front or the back by providing stability, and the meniscus bears the whole weight being present at the center of the knee joint in order to prevent stress hoops to the cartilage which is being there. Any tear in the meniscus or any cleavage along the plane is going to disseminate the weight and going to pass the issue. So the reason why this class on special tests for the knee is done is in order to know which part is affected, in order to know which part is causing the pain, and in order to derive something from it. So starting at what you need to see, the cruciate ligaments, which is the anterior and posterior cruciate ligaments, the meniscus, the medial and the lateral, and the collateral, which is your medial and lateral collateral. Coming to the anatomy of your anterior cruciate ligament. The thing that needs to be noted when you're going to see for the anterior cruciate ligament are there are two bundles of the anterior cruciate ligament. One being the anteromedial bundle and the other one being your posterolateral bundle. Both these start as the starting point of where your ACL arises and attaches in the posteromedial aspect of the lateral femoral condyle to the anterior tibial eminence. Next, what is the function of the ACL? The ACL functions in retaining the anterior tibial translation. So this is in these three images, the image of the knee joint flexed with the maximal taut position of the ACL. Here you can see a midsection of the intercondylar notch where you can see the Blumensatz's line or the intercondylar notch, where you can see for the attachment of the ACL. You need to know that the ACL is oblique in attachment and not straight. So even when you're going to see cut sections in the MRI of the SAG views, unless you're going to see representative images, you will not 100% know whether it is present in continuum or not.